Let's talk about the business line now. In fact, some days on the show, we're very much focused on the business line, where there's been a new announcement on help for employers or employees. But today the focus has been very much back on testing and on care homes, and it does move around an awful lot. But one man who's been consistent in calling for the lockdown to be lifted at the earliest possible opportunity is Luke Johnson. He's chairman of the artisan bakery Gail. You know him previously from Patisserie Valerie. He was former chair of Pizza Express and indeed Channel 4. I'm delighted to say he joins us now. Good morning to you, Luke.
Morning.
Good morning. Now, you've been very consistent in calling for the lockdown to be lifted as soon as possible. What is your main concern about the lockdown and its effect on business?
Well, I think it's not just on business, but its effect on society. I think that a frightened society is a failing society. It's costing us, by my estimate, £4 billion a day as a whole to keep the economy shut down. We could be on our way to perhaps 5 million unemployed. As you heard earlier, there are many unintended consequences of the lockdown, such as extra deaths through cancer patients not being diagnosed and treated in time. And we should not be an overly risk-averse society. The Project Fear Mark II, which is the one that government has undertaken to frighten us to stay in our homes, mean that children are not being educated. We are suffering huge numbers of insolvencies, and I think we haven't even seen the worst of that yet. And we are depriving people of their liberty. And I think that enough is enough, and we need to send our children back to school. The government needs to reverse tact in terms of their propaganda so that people are not fearful. And we need to follow the example, perhaps more, of Sweden, where they have not undertaken this lockdown. And it seems that deaths are, if anything, better than here per million. And they are not destroying their economy in the process.
Well, there's been lots of attention paid to Sweden, a very, very different route from certainly any very European country in terms of not having a full lockdown, cafes and restaurants still open, but trusting the people to sort of, exercise sense and caution with social distancing. However, their death rate is far higher than comparable countries, other Scandinavian countries with similar population densities. Yes, they've got a lower death toll than some of the other mainland European countries, but bearing in mind they don't have a huge population. They're very spread apart. They've got a large number of single households. It's a much wealthier country per capita as well. There are lots of reasons other than their lockdown policy that may explain that.
They may and they may not. You compare them to Belgium or you compare them to Ireland, and they're doing much better. And Stockholm is not an empty city by any means. So I think there are arguments both ways. But we didn't follow their policy. I now think that we should focus on the unintended consequences and the collateral damage from the lockdown and say that this obsessive focus exclusively on COVID to the exclusion of everything else in society is damaging. And we need to look at the bigger picture. And I'm afraid that by taking advice more or less exclusively, it seems to me, the government from academics and civil servants and disregarding the other aspects of our life. The truth of the matter is that the risk for people who have no comorbidity and are under 70 is very low indeed, generally speaking. And therefore, to keep all those people locked down for extended periods is, I think, damaging to their health overall, be it mental health, be it the risk of unemployment and all the consequences that flow from that.
And we know, don't we, that this isn't just sort of the health v wealth or the health v argument, health v economic argument. We know that the economic downturn will have knock-on health effects that will cost lives, and many are saying may in the long term cost more lives. But of course, there has been this fear that the NHS will be overwhelmed. Would you endorse, say, for instance, a lockdown easing, people wearing face masks, but returning to work, returning to using public transport, kids returning to school, but those who are vulnerable because of their underlying health problems or over 70 being told to remain on lockdown to keep the death toll down and keep the pressure on the NHS down? Would that be some sort of compromise you would be happy with?
I think it's up to the individual, because I believe we're in a democratic free society. I think if people are afraid, then they should stay in their homes if they believe that will keep them safe. The fact is, my wife's at an NHS hospital now. She's a pharmacist. She's on the front line. And, so as a family, we know what it's like. But the truth of the matter is, we have to think of the other aspects of this before obsessing exclusively on, there are 650,000 deaths every year in the UK, and we've got to put it in context, and I fear that we're not.
Do you think this is a government that's fearful of being seen not to care the ongoing allegations that the Tories, the NHS isn't safe in Tory hands, and the fear of the sight of the huge number of deaths and those graphs, the body bags, literally the body bags appearing right now, is dominating over possible long-term risks?
I do. I think that, unfortunately, God forbid I'd criticise it, but I think the media plays a disproportionate part in informing public debate. I think that the government, the politicians, are obsessed about the media, and I think they early on reacted by insisting on the lockdown, and I think they now have to take the opposite tack and say, we don't, at £4 billion a day plus, this is too expensive to carry on in terms of all the consequences of flow. We have to fund the NHS. And if the economy is too weak to do that, then we haven't protected the NHS, which was one of their slogans.
Okay, well, thank you very much indeed for joining us. I know there are many people who will echo your concerns there. Luke Johnson, thank you for speaking to us. He's chairman of Artisan Bakery. Gail